So today we want to talk about the impact of defaults in retirement savings plans in the public sector. And so we know a few things about defaults from a lot of recent papers, but they all tend to focus on one particular area of the economy. So we're going to be talking primarily today about a retirement savings plan that adopts an automatic enrollment policy. And for those of you that are not into the lingo, that means you're hired, you're in, they take money out of your paycheck unless you decide to opt out. Whereas until recently, the traditional plan was you had to actively sign up to be in one of these plans. And if you didn't, you weren't in. So traditional plans, you had to actively get there. From an economic standpoint, before we heard about behavioral economics, you might think this shouldn't matter. But in fact, it makes a big difference, and we'll see some numbers here in just a minute. We've had a series of papers, most of them by one particular team of researchers looking at the private sector, and what they found is that in the absence of automatic enrollment, participation in these plans is about 60%, 65% or so. With automatic enrollment, it goes up to 90% or so. So a big increase, even though the only difference is whether you have to punch the button to get in the plan or punch the button to get out of the plan. Obviously, if you have a plan that opts people, that puts people in, you have to specify some defaults like how much the contribution is going to be and where the money is going to go. And we'll talk a little bit about that as well. And what we find is that big increase in participation from these studies, concentration around the default contribution rate, no matter what the company sets it, that's where people, maybe they take it as a recommendation, but that's where people end up. And the other thing is, because you get a lot more people in, you sort of eliminate most of the variation across the people. So one concern about the traditional plan is that low-income people, minorities, tend to be the ones that don't contribute. This moderates those differences. So the question is that we've had all these studies, why do we need a study of public sector plans? And so if we look at the previous studies, they basically were all on private sector plans. They basically were all on private sector plans that had no other retirement benefit. So this is your only benefit, is your retirement savings plan. And employers in the private sector generally have pretty nice employer matches. Maybe it's 100% on the first 3%, 100% match on the first 3% of contributions, or 50% on the first 6%, but there's real money to be left on the table if you don't sign up. There is one study of a public sector plan by Gopi. Where'd Gopi go? That plan is on federal workers, and she and I have talked about this in the past. The federal thrift savings plan is really a very generous, more than what you find in the private sector plan. If I've got this right, the feds put in 1% of salary whether you do anything or not. So one issue is everybody knows about the plan. And then two, they do 100% for the first 3% and then 50% for the next 2%. And her paper says that without automatic enrollment, participation is like 91%. With automatic enrollment, guess what? It goes up to 94%. So not a big deal in the public sector, in part because of the characteristics of the plan. And of course, they also have a DB plan behind that. So the big difference I'm pointing out is that public sector versus private sector, everybody but Gopi's got the private sector. But the plans we're going to look at are much less generous, but still built on the top of a DB plan. So in the public sector, virtually all of the full-time public sector employees are covered by a mandatory pension plan of some type. And most of them are defined benefit plans. So most state workers, most public sector, city, county workers are covered by a defined benefit plan. And these plans are generally more generous than you'd find in the private sector. Most of them would have some replacement rate of, a benefit formula of about 1.7 or so % of salary per year of service times final average salary. So before you do anything, if you stay there for 30 years, most public sector workers are also covered by Social Security. You put all that together and they're looking at a 75% replacement rate without saving anything. So maybe there's a lower incentive to save as well, so maybe we ought to look at this as well. Other thing about this is that virtually all states and local governments offer people the opportunity to contribute to a retirement savings plan. In the public sector, that could be a 401k plan, it could be a 457 plan, it could be a 403b plan. Maybe something else too. Public sector employers typically do not provide an employer match. So no employer match, and there you've got this defined benefit plan to build on before you get started. So we might say, well, do we really expect these people to save additional money? And if so, how much? And then what's the effect of automatic enrollment in this environment, which is much different environment than in the other studies? From a policy standpoint, one of the things that we might be concerned about is the fact that over time, public sector pensions are going to be less generous. State after state, city after city have introduced reductions in their pension plans, not necessarily for existing workers, so this is a ways out, but for new hires, they get a less generous deal than the previous workers. So in the future, these plans may be built on a defined benefit base that's lower, which might make the emphasis on saving through a retirement savings plan more important. And so we ought to be thinking about, if that's true, how can you get more people into these plans? Despite a very rapid increase in automatic enrollment in the private sector, there's not a comparable increase in automatic enrollment in the public sector. So relatively few public sector plans have automatic enrollment. In the private sector, depending on whose numbers you look at, maybe 50% of firms with a 401k plan have automatic enrollment these days. So let's look at some numbers then, perhaps. The way we're going to look at some numbers here is we obtained some data, and my co-author on this is Denis Pelletier over here, a colleague at NC State. We got this data from the South Dakota retirement system, and one of the reasons we went to South Dakota is South Dakota was one of, if not the first state to institute an automatic enrollment plan in their retirement saving plan. They do have a base of a defined benefit plan. If you work 30 years, you're likely to have a replacement rate they're also covered by Social Security, you're likely to have a replacement rate of 70, 75, or 80%, depending on a few characteristics there. They have a no match. Their plan is a 457 plan, which is basically the same characteristic that 401k plans with a few exceptions. Denny and I have a paper that describes in detail the differences between 401k, 457, and 403b plans. And when we look at public sector plans, there's really no systematic data about the participation rates in these plans. Melinda and I and some co-authors have a paper that looks at North Carolina teachers, and there we find about a third of the teachers contribute to some retirement savings plan. In North Carolina, it's a sort of a strange outlay of different kinds of plans. North Carolina teachers can contribute to a state-managed 457 plan, a state-managed 401k plan, a locally managed 403b plan, or a locally managed 457 plan. You put them all together and you get about a third of the people contributing to one of the plans. And some people contribute to all three, by the way. In South Dakota, when we look at South Dakota, we'll see some tables in just a minute. The first year of hiring, less than 5% of the people are contributing to the 457 plan managed by the state. So very low contribution rates, certainly much farther away than that 60% that we have seen in the private sector studies. So what did South Dakota do? In 2010, they adopted some legislation or passed some legislation that allowed all the state agencies covered by the South Dakota retirement system to decide whether they wanted to adopt automatic enrollment or not. They did not require them to. And this is going to be an interesting study because ultimately not everybody adopted it. So relative to other studies, we have a side-by-side comparison in the same year as well as a time series comparison through time. They also put a very low contribution rate, required or default contribution rate of $25 a month. That turns out to be about 1% of the average salary of a South Dakota public servant. This is, people in the South Dakota retirement system include all state agencies, university systems, public teachers, and city and local county workers are also covered. So it's a very broad base. Each agency, however they defined it, was allowed to be in or out. If they decided to choose automatic enrollment, every new hire had to be automatically enrolled. So the South Dakota system actually came to us and wanted a study on this, and we said we would do this, and they provided us data on all new hires in the entire state of South Dakota, public sector employment, from 2005 to 2016. So we have year-by-year hires for whatever that is, 12 years, and we've got about 5 or 6 years before automatic enrollment and 5 or 6 years after automatic enrollment. So we have really a sort of a longer time series than the previous studies around the same issue, and we can observe the impact of the introduction of this plan. So here's the pre-automatic enrollment data, and you can see the percentage of hires that enrolled, and by enroll we mean where they're contributing at the end of their first year, and those numbers are pretty small. And they were pretty steady over that entire period. So not much going on. Perhaps that's because those folks are looking at their expected 70-75% replacement rate and saying that's enough, but we all have to remember that not everybody's going to work 30 years either. So what happens after 2009? Starting in 2010, they have automatic enrollment, but we have two different groups, those that are automatically enrolled and those that aren't. And if we look at whatever this middle column right here is, we see that the total number of people across the entire state, instead of being less than 5%, all of a sudden is 40% in terms of total contributions. But then if we look at the difference between those people that were automatically enrolled and those that weren't, we get this finding that's pretty close to what they found in the private sector. If you were in automatic enrollment, your participation rate at the end of the year is about 90%. If you weren't automatically enrolled, that actually goes up a little bit too. One might think that's sort of some people looking at their neighbors and deciding to contribute. But the big jump is for those automatically enrolled. And maybe that's due to a low contribution rate. Maybe it's due to some other things. But clearly, a very positive and strong effect that we find for the automatic enrollment in this setting with a defined benefit plan available. And this is just a chart showing you that big jump around 2009 for the total population, and then the difference between automatically enrolled and those not. So another thing that we can do, because we've got this fairly long time series, is to see what happens over time for the hirees. So again, we're looking at a year that people are hired and following them for the next few years. So the person in 2005, we actually have those 12 years of data. And what you see for people that are not automatically enrolled, and this is the usual finding, is that participation rates go up over time. So people get to earn a little bit more money, maybe they think a little bit more about retirement, and over time the proportion of people contributing goes up. And then the bottom part of this table is everybody together, and so you see that that goes up relative to the first 5 years in our data. Now, for the last 6 years, we have 2 lines for each year. Same year, hired, automatically enrolled, hired, not automatically enrolled. And what you see is that for the people in each year after they were automatically enrolled, participation rates go down over time. For those that are not automatically enrolled, they go up over time. And again, this is a fairly, standard finding. You're automatically enrolled, it takes you a little while to figure out maybe you don't really need that, so you exit. You're not automatically enrolled, and it takes you a little while to figure out, yeah, I better start saving, and we see those going up. But again, a nice contrast here that no other study, I think, has done with this difference between, and remember, everybody's covered by the same pension plan, basically the same salary structure type things, basically the same health plan. So they're just in different agencies and the agency choosing to adopt or not to adopt automatic enrollment. So if we do a series of short regressions, the notion here is that we're trying to observe the impact of automatic enrollment on the variables that we have. So remember, this is administrative data and all the limits that go with that. So basically, we know the person's gender, the year they were hired, their salary, and of course, them basically in the first year. So tenure, we have tenure, but it's not important in this case. And you see that if you do not interact with coverage by mandatory retirement, we get some results here that say males are more likely to contribute than females, higher salaries are more likely to contribute than lower salaries. And then with mandatory automatic enrollment, you see that the interaction term is exactly the opposite sign and essentially wipes that out. So if you're looking for another positive effect of automatic enrollment, basically it moves people toward a more homogeneous participation rate in this particular retirement savings plan. So once again, we're just looking at the interaction terms. We do this in a couple of different ways. So this is only, the previous slide was the entire sample period that we had from 2005 to 2016. Now we look just at the time period of when some agencies had adopted automatic enrollment, and we see basically the same effect, some basic effects that we might expect with age and male and salary, which other people have found. You with coverage by mandatory retirement, and again, this is the same years, just whether their agency adopted mandatory automatic enrollment or not, and basically, again, the effect of these limited personal characteristics go away. So, then we can also say, well, let's look just at the agencies that adopted automatic enrollment, but for the entire time period. So that's from 2005 to 2009. These are agencies that ultimately adopted automatic enrollment in 2010. So we've got data on the same agencies before and after. And again, we run our simple regression here, and you see more or less the same thing, that the interaction terms essentially wipe out the findings on the individual characteristics. So one last thing that we wanted to do is what we know from our studies of North Carolina teachers is that they got these other plans. So a lot of school districts offer 403B plans. They may be covered by a state plan, but the local school district offers a 403B plan. And so when we started doing this, I was concerned that maybe we're missing something there in terms of the states, the agencies, where people have another option for a retirement savings plan. And so we basically just ran our regression. We could look at the data as well with those that were non-schooling agencies. And then, of course, we looked at schooling agencies, and the basic results are pretty much the same. That automatic enrollment makes a big difference, and it washes out the personal characteristic differences to a large measure. So when we think about what's the importance of a study like this, one, it is that automatic enrollment has a large effect even if there is a defined benefit plan as a base retirement system. So these are people that already have a pretty solid retirement income if they stay with the state or local government. But on top of that, once automatic enrollment is, a lot of them stay in. But if it wasn't there, or when it wasn't there, basically less than 5% of the people were contributing. So pretty big difference. It washes out the differences by age of hire, gender, and earnings. And so I guess the point I would end with that if we really believe that public pension plans are going to be less generous in the future, and that's where all the evidence is, state after state has introduced new changes that lower the generosity of benefits for future retirees, then additional retirement savings plans or retirement savings are become more important for public sector workers than they are today. And the idea behind this study was really, if we only have 2 or 3 states that are doing this now, why aren't they? And maybe they think, well, we already have this pension plan, but they're not putting any money in these plans other than, I guess, some administrative costs perhaps. But perhaps if one notices these kinds of responses, then some of these other states might choose to adopt automatic enrollment for their supplemental retirement savings plans. Should say that some states have defined contribution plans as their primary plan. And again, this is the difference between the public and private sector. Those public sector DC plans are mandatory. So it's typically you would not have a choice to be in or out. You wouldn't have a choice about how much to contribute. It would be like I'm a state employee in North Carolina, I'm at the university. I could be in the state DB plan, but I chose to be in what they call the optional retirement plan. They take 6% out of my paycheck. I can't get out of that. They just take it. And then the state puts in 6.82% of my salary. So by Stanford standards, I'm sure that's cheap, but it's even low by a lot of public sector, public universities. But I don't have a choice. Well, I did have a choice between the state plan and this plan. But if states offer a DC plan either as the only plan or as a choice, if you're in that plan, that's it. You have to be in it. So this is, and perhaps I've always wondered why private sector companies didn't do that when they shifted out of defined benefit plans where they were automatically putting people in. Why didn't they do that the same thing for the DC plan? But they didn't, and the public sector, they do. Thank you.
It's good to be back at CPER, having a paper being presented, but also discussing. So I am going to be just offering some brief comments. As was mentioned, there are a number of papers that show that there are these default effects or framing effects that increase participation in retirement savings plans. This paper confirms those same patterns, but what are some of the new things that we learned in this setting from this study? So as was mentioned, the first thing is that we're in a different sector with this type of study. There are a couple of studies that look at enrollment in the federal level in the thrift savings plan. But this is at the state level where there are different dynamics taking place, especially as was mentioned with respect to them scaling down, maybe scaling back on their pensions and these types of supplemental retirement plans being more important. So we're looking at a setting where we have an entire state that was exposed to a new default rule. Also, relative to the studies in the private sector, there's a difference here because there's an existing mandated DB plan. So the thing that we're going to be studying or looking at is an additional amount of savings above and beyond that. There's no match, and so you might think that that may lead to people opting out more quickly than, say, in the private sector. But on the other hand, there's a low default contribution rate. So if you were planning on opting out, the cost of not opting out might be smaller because there's not as much that you're being defaulted into contributing. So those things could go in two different directions. One other thing I want to talk about is in this setting, there's some interesting scope to study some spillovers in participation and behavior, some of which was discussed, some of it is in the paper, so I'm going to highlight some of those as well. So in terms of, I have some comments for the paper, so I enjoyed reading the paper, and I have some comments on some additional things I think that would be good to see given the nice data that you have in the setting and the natural experiment that you have. So the first thing is that the basic design is that you have before and after 2010 a change in policy, and that policy change is only for some of the agencies within the state. So you have, the recipe for, essentially a difference in difference design. One thing that I think would be useful, the study, it's pretty much apparent that there are these default effects, but what would be useful would be able to plot the data separately for the agencies that adopt and the agencies that don't over time, and show the classic, difference in difference picture. So I can't tell from the tables currently in the study whether the participation rates were exactly the same in those two agencies or whether they were different. So it'd be nice to just plot those and see if they have the same trend over time as well. And then you can get a sense of how much of the difference in the post period is picking up a trend versus of being driven by the change in default policy. And then it also would be useful to give some descriptive statistics broken down by the types of agencies that do adopt and those that don't. Are they similar? Are they different in any way? Do they have different composition or different types of workers? And so that would be useful to know as well, because a lot of what you do in a post period is comparisons between these two types of agencies. The difference in difference model, you have an outcome variable that is a binary variable, but I think you can also get away with a linear probability model where this parallel trend cleanly translates into you identifying the causal effect. You probably would get, I imagine you probably get similar results, but, and then the final thing is that you do, just to seal the deal, you can do the standard things like a placebo test, just using the data before 2010. This is just to test that there are parallel trends. You can pretend that the policy actually happened in 2007 or something, and just use that pre-data. You shouldn't find an effect, and that just confirms that the trends are not differential across these two types of agencies, the adopters and the non-adopters. And then if these outcomes have a lot of serial correlation, then that could affect your inference and your hypothesis testing. So there are different ways of doing inference in this setting, and one common way is to use randomization inference to get a sense of how precise your estimates are and when you're doing your hypothesis testing. So just a lot of difference in difference best practices. So one thing I wanted to highlight that is in the paper but wasn't discussed in the talk because we have limited time was that there is, I think, a very interesting novel result that you can see in the paper, which is that they plot the contribution rates, the average contribution rates in the adopting agencies and the non-adopting agencies, so the agencies that don't have a default contribution rate. And in the post-period, so in the pre-period, the average goes from around 2 or 3% down to 1%, so people in the defaulting agencies get anchored at the new contribution rate, which you also see in other settings. But what you also see is that in the agencies that don't adopt, they also have their contribution rates decreasing in the post-period down to about 1%. I found that to be pretty interesting because as far as I can tell, there wasn't a default contribution rate introduced in those agencies. So there's a question about whether that new contribution rate was now just interpreted as a thing to do among all the workers. So I think it would be useful to show that more formally. You can use the same difference in difference setup to see what happened there. And in fact, you might find a null effect because the contribution rates kind of track each other. And actually, you wouldn't expect to find a null effect in this case because only the default rates should make adopting agencies have a decrease relative to the non-adopting agencies. You may not see that, which is still informative. And I also think here it also is useful to make sure that we know everything about the institutional context. You might benefit from a little bit of qualitative evidence or investigation to figure out what happened here. Why did these non-adopting agencies reduce their contribution rate? Was this something that was advertised to everyone, or how does why did they lower their contribution rates in this post period? Another thing that you can see in the study is that of the new hires, the participation rates do increase post-2010, even in the non-adopting agencies. So new hires have a higher rate of participating, especially in that first year, 2010. They went from like 2 to 3% to like 7, or I don't know the exact number, but their rate went up from around 3% to like 2 to 3% to like 7% among those new hires. So one way to interpret that is that there was an additional spillover in participation, but it's hard to tell because that could have just been the time trend in the state. It is kind of abrupt, so that might be suggestive that there are these spillovers in participation as well. With the data you have, there's another way that you can kind of look at spillovers that might be interesting. So basically, the idea would be to only use employees who were hired before 2010. So they don't have any variation in their default rate, as far as I can tell. This is only for new hires, right? So I would just do a difference in difference analysis with old hires, people hired before 2010. And that will give you a sense of if you were hired in 2009 and then your agency adopted a default rate or a default rule in the next period, are you more likely to participate? Even though you are not defaulted in, your coworkers are much more likely, especially your new coworkers are much more likely to be participating. So it would be interesting to just look at the old hires or earlier hires and then see if they have any potential differences relative to those in the non-adopting agencies. There is some increase with tenure that you can see even in the data just by looking at everyone pooled together. So there is some scope for people opting in even after they're a new hire. So you might find some changes there. And then a trickier question is, is this good or bad that they are being defaulted into this plan? And, generally, that's a hard question to answer when people are affected by the framing of the choice. And it's hard to know for whom this is good and for whom it's bad, or maybe not the best idea or not optimal. In addition, you have a unique situation here where as was mentioned, with Social Security plus the existing DB, you have a relatively high replacement rate as your baseline for retirement, at least among these workers, if they continue to work throughout their career in this state system. And so, for those who are defaulted, is it a mistake, or are we undoing a mistake or introducing a new mistake? So, one thing you might want to look at is this recent paper by Golden and Rec, where they apply to the same type of setting where you have a default policy or default enrollment, how you might be able to bound the welfare effects of these types of policies using the patterns in default or in enrollment behavior before and after. So in an exact type of same setting that you have, they discuss how you might try to go about evaluating, at least putting some bounds on the welfare implications of this policy. So I would also recommend that for an extension. Okay. Thank you. Thanks.